And thank you for coming to February's Howard County Council meeting. If you'd all rise, we can join Councilman Fred Faulkner in the Pledge of Allegiance, please.
Please join me in the pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
Councilwoman Lake.
Shall we bow our heads for prayer? Lord, we are so thankful for you, for your love, for all the answers to prayer, for taking such good care of us, for our families, for our work families. We have so much to be thankful for. We thank you for this community, and we are so grateful that we were born here and not somewhere else, because we have such a wonderful community, and we just pray that you continue to keep it healthy and happy and prosperous, and help us to have the growth that we need, and help us to have the atmosphere and the home feeling that we have. Keep us yours, and keep us humble, and keep us in your care. We just thank you for local government. We thank you for state government. We thank you for federal government. We thank you for those who are leaders. We thank you for those who are leaders in our community, even though they may not have on a leadership hat. Everyone in the county and in working in government is a leader to the people, and we just thank you for them and for the people that we're working for. And just bless this council, help us to make wise decisions. Help us as we go forward, and keep us in your care, in your will. In Jesus' name, amen.
Amen.
My feet was so shut. My feet.
Our first order of business will be to approve the minutes from the January 23rd council meeting. Has everybody had a chance to read and minutes? Is there any questions or comments?
I'll move that we approve the minutes. I do have a comment.
Please.
So my comment is related to the last page. It was a discussion that we had relative to having a financial advisor, contracting with a financial advisor. I think it's a good idea. I think having Martha Lake as a liaison with a financial advisor is a good idea. But as I read the minutes, I want everybody to know that I'm not locked in on Baker Tilly. I think they would be good, but not necessarily the only game in town. So there's other financial advisors. I know we're going to be talking to some others, and I just didn't want everybody that's reading the minutes to think that I've only got one dance partner on this dance floor with regards to financial advisors. So that's all I want to say.
And I'll second that you approve the minutes as they're written.
Yes,
Okay.
Okay, the motion's been properly made and seconded by Councilman Faulkner and Councilwoman Lake. All those in favor say aye.
Aye.
Opposed, same sign. Motion passes. Thank you very much. Our next order of business will be to move to additional appropriations. Madam Auditor?
Ordinance number 2024-HCCO-06, additional appropriations. Whereas it has been determined that it's now necessary to appropriate more money than was appropriated in the 2024 annual budget. Now therefore be it ordained by the County Council of Howard County, Indiana, that for the expenses of the taxing unit, the following additional sums of money are hereby appropriated out of the funds named and for the purposes specified, subject to the laws governing the same. County General, Coroner, Secretary, $3,083.70. Probation, Assistant Probation Officer, $834. Juvenile Probation Secretary, $834. Total County General Fund, $4,751.70. Lit Special Purpose Fund, Jail, Institution and Medical Supplies, $4,105.27. Total Lit Special Purpose Fund, $4,105.27. Public Health Crisis Response Grant Fund, PERF, $3,000, insurance, $2,000, other supplies, $30,000, professional fees, $60,000, equipment, $70,639, total Public Health Crisis Response Grant Fund, $165,639. Juvenile Probation, Mayor's Council Fund, other supplies, $500. Dues and subscriptions, $3,254.05. Total juvenile probation, $3,754.05. Total additional appropriations for all funds, $178,250.02.
Thank you very much. I don't see Dr. Seeley.
I am, that's
Mm-hmm. Madam Auditor is going to present Dr.
this-
Seeley's presentation.
This was PAC approved. He has two positions. One, or his deputy will be retiring, I believe, maybe at the end of March. And he just needed to bring on another deputy to train before she retired. So he's just requesting to have another deputy being paid for an entire month.
Mm-hmm. Yeah, this did go through PAC, and we discussed it, and it seems like just a wonderful idea to train the replacement of the valuable employee that he's losing. So that's the sum of the $3,083.70. Is there any questions about that members might have? If we could have Justin DeLong.
That's okay. Good evening.
Good evening.
I have a couple of things here to present in front of you. I'm representing Connie Burton with juvenile probation as well tonight, so she's had a few things to do this evening. Our first agenda item is an additional appropriation in the county general for $1,668. This additional appropriation is to make sure that we've accommodated the last year's raises for these two employees, so the 5% increases. It was only applied under one fund and we missed some of it. So what we had to go back and do was reappropriate that missing percentage that we didn't get on our original budget this year. So that's all that is. That's to get them to the full 5% increase from 2023 or 2024. Are there any questions about that before I start the juvenile?
No, go right ahead.
Okay, great. So juvenile probation was awarded $5,500 from the Community Drug Free Substance Abuse Prevention Group, the Mayor's Council, in 2019. As of 1/1/24, we have about $3,754 remaining in that fund. Connie's requesting to have that appropriated as you have in front of you under supplies and under our services. The funds will be used to assist youth who don't have funding to participate in organized sports. This is an incentive program, so folks who are doing well would be eligible to participate in their organized sports, attend cultural events, join community organizations, and there's been some studies that correlate the relationship between substance use and extracurricular activities, and found adolescents who participate in organized group activities were less likely to smoke cigarettes, drink alcohol, and use marijuana. But the funds are also for equipment and supplies that are needed to participate in these activities. So I think one time, just an example, they took a group of youth to a Jackrabbits game, which was something that was fun for them. They experienced it, took their families. It wasn't just the kids with our staff, it was the kids, their families, family situation, try to reinforce that familial bond and in other ways than your traditional office setting. those are the only two things that I have in front of you today, I believe.
Well, that certainly is a noble use of money to include the young people in activities that'll promote a healthier lifestyle, and it's just very good.
Our juvenile department really thinks outside the box. They started taking youth from the shelter care to do Meals on Wheels sometimes with them and deliver meals to people who can't get out of the house and things like that. There's been some good responses there. So our juvenile department and our adult department, they think outside the box and try to get people engaged in different events to help them prepare them for the rest of their lives.
Yeah. Is there any questions or comments for Dustin? Thanks
All
for
right.
coming up and sharing that with us.
Thank you. Have a nice evening.
Sheriff Asher?
Mr. Faulkner, I think after 55 years, the only person you should dance with is Peg. That's just my personal opinion.
I got a mop to dance with at church.
Yeah, there you go. What I'm here for is an additional appropriation of $4,105.27. This is basically funds that were collected from October to December of 2023. We obviously didn't receive the check until January the 9th of 2024. Basically, we were just wanting to put that money back into account 1114-23350-000.0380. That's our medical funds. So money that we were collected for October through December from facility medical funds, we're just asking to put that back in there.
Mhm. How's things going at the jail, Sheriff?
Oh, it's still there.
Yeah.
1800 West Markland. Jail population's kind of creeping back up. We've sent quite a few out. I think we've just about 32 inmates up to Cass County. Our jail in-house jail numbers 375, I think, this morning, with about 30 out. So a little bit over 400 total of inmates. So
Mhm.
just to give us a little breathing space, we've been moving people up to Cass County for their help.
Okay.
Yeah.
Are there any questions or comments for Sheriff Asher? Thank you very much for coming in. Mr. James Vest, please. Public Health.
Good evening.
Good evening.
I'm just looking to appropriate some additional funds that we received through the Public Health Crisis Grant Fund. We received additional $160,000. Just need to get that appropriated for the remainder of the year. So we're looking for $3,000 in PERB, $2,000 in insurance, get us through with that employee, and $30,000 for supplies, $60,000 in professional fees for our partners that we partner with to do services that we have, and the equipment, another $76.39 for the entire amount that we received to be appropriated.
Mhm.
That is all I have. Do you have any questions for me?
Well, your department's growing. How's it going?
It's going good. Not looking to add anybody new yet. Maybe something to talk about for next year, but growing. I think I reported last time I talked to you that we're working on our completing our statewide KPIs. We have to develop county ones by the end of the year. So there's some things that we need to get done, but plugging away at it. Everything's going well. This is a
What kind
really
of
good program
equipment
we've got
would that
here.
be?
And yeah,
What kind of equipment would that be?
we spent a lot on AEDs. There's a lot of AEDs purchased for schools, any other types of equipment that the schools are requesting. This is specifically for that. So, same with supplies. We buy a lot of hygiene supplies for the schools for them to distribute to kids that need needs for that. Any other questions?
Thank you for coming in.
Is this all school money, or is it for, or basically for schools, or is it for
Yeah.
any?
Yes.
Yeah,
In
okay.
public health concerns with that.
Thank you.
Thank you.
Any questions or comments about the additional appropriations? If
Mr.
not,
President, I move we approve these additional appropriations as presented.
Second.
Motion's been properly made and seconded by Councilman Faulkner and Councilwoman Lake. All those in favor say aye.
Aye.
Those opposed, same sign. Motion passes. Thank you. Our next order of business will be to move to transfers. Madam Auditor?
Resolution number 2024-HCCR-04 transfers. Whereas the county council may approve the transfer of money from one major budget classification to another within a department or office. If the transfer does not require the expenditure of more money than the total amount set out in the budget is finally determined, and if the transfer is approved at a regular public meeting and by the proper ordinance. Be it resolved by the County Council of Howard County that it's desired and deemed necessary that the following transfers be made within the accounts of the designated funds as set out below. County General Fund Surveyor, First Deputy to Field Technician, $52,094. Prosecutor, Deputy Prosecutor Magistrate Court to Deputy Prosecutor Superior Court 3 Magistrate Court, $50,204. Deputy Prosecutor Magistrate Court 2 Contract Services, $994. Office allowance to Deputy Prosecutor, $10,000. County user fee pretrial diversion fund employee service bonus to Deputy Prosecutor, $7,177.
Thank you very much. You can have Surveyor Greg Lake, please.
Evening.
Good evening.
So this transfer is dealing with what we had went through in PACS, reference to the transitional deputies position that we had hired an individual to learn the job so that when such time things moved in our office, he would move into the first deputy's position. That left that transitional position empty for this year. After requesting to fill a new position, a field technician position in the surveyor's office, PACS that agree with that, and so we wanted to take that money from the transitional position, put it into the field tech position to fund that. That's what.
Mhm. Mhm. And how is it going in your office? I know there's been a lot of changes going on.
We are very busy.
Mhm.
That's the easy version. We are out in the field, things are starting to pick up. Trying to get the paperwork done so that we can start construction here as soon as weather allows. And we have 70-degree weather, so I'm
Mhm.
hoping for freezing here soon, keep the farmers out of the field a little bit longer. Because we are gonna lose if we don't. They're gonna be planting soon, aren't gonna have our work.
Yeah. Well, we wish you the very, very best. Is there any questions for Greg Lake?
All right,
Thanks
thank
for
you.
coming in. Appreciate it. Prosecutor Mark McCann?
Afternoon.
Good afternoon.
Once again, here to request $10,000 from County General Fund Prosecutor 1000.0009, and also I think 7,000 and some change out of the pretrial diversion fund to cover salary increase to a full-time deputy.
Mhm.
Any questions?
Any questions or comments for Prosecutor McCann? Well, it looks like we got this ironed out, and it's making Madam Auditor happy, so we're happy.
We square?
Square.
All right.
Thank you very much.
Thank you.
Thank you.
Is there any questions or comments about the transfers tonight? If not, I will entertain a motion.
Move to approve the transfers as read.
Second.
Motion's been properly made by Councilman Alexander and Councilman Maple. All those in favor say aye.
Aye.
All those opposed, same sign. Motion passes. Thank you. Let's see. We will now move on to salary ordinance amendments. Madam Auditor?
Ordinance number 2024-HCCO-07, salary ordinance amendment. An ordinance amending and increasing staffing and salary authorization to be paid county employees for the calendar year effective January 1, 2024 through December 31st, 2024, as originally approved for the year 2024, except where otherwise noted. Be it ordained by the Council of Howard County, Indiana, that for the said fiscal year, the following salary amendments are approved as additional changes to the basic salary ordinance for the same fiscal year. Necessary personal service appropriations have been approved previously to support the required expenditure of necessary funds. County General Fund, Surveyor, First Deputy, reduction $52,094. Field Technician, $52,094. Coroner, Secretary, $3,083.70. Prosecutor, Deputy Prosecutor, Superior Court 3, Magistrate Court, $50,204. Deputy Prosecutor, Superior Court 4, $10,000. Deputy Prosecutor, Magistrate Court, reduction $51,198. Probation, Assistant Probation Officer, $834. Juvenile Probation Secretary, $834. County User Fee, Pretrial Diversion Fund, Employee Service Bonus, reduction $7,177. Deputy Prosecutor, $7,177. Public Health Crisis Response Grant Fund, PERF, $3,000. Insurance, $2,000.
Thank you very much. Is there any questions or comments about the salary ordinance? If not, I will entertain a motion.
Move to approve the salary ordinance 2024 HCCO 07.
Second.
Motion's been properly made and seconded by Councilwoman Lake and Councilman Sanders. All those in favor say aye.
Aye.
Those opposed, same sign. Motion passes. Thank you. Is there any old business we need to tend to? We have some new business tonight. We have Dr. Matt Oliver from Turning Point to give us a review of Turning Point 2023. Dr. Oliver? Thank you. I actually have one. If you're short, I have one. Oops.
Thank you.
Thank you.
My name is Matt Oliver. I am the CEO for Turning Point, and I come tonight to tell you a big thank you for supporting our county commissioners and for funding Turning Point. We wanted to report back on our 2023 activities and to give you a chance to ask us questions as we try to be very good stewards of the funding that we receive from Howard County. As I told commissioners, it'd be no small exaggeration to say that we could not have done what we did last year without the support of the county. And last year was the first full year that we were able to operate the Recovery Stabilization Center, and that offers effectively 24/7 crisis support and stabilization, as well as rapid access to TTOX and withdrawal management services. What it effectively does is provide a game changer for our community to divert volumes away from the emergency departments, as well as, I think, incarcerated placements, so that we can help those that are struggling with substance use and other psychiatric issues to be stabilized and to stay away from, or to limit involvement with the criminal justice system, as well as to decrease the burdens on the emergency departments. If you've talked with folks that operate the emergency departments, folks that come in for behavioral health services, generally take somewhere between 10 to 15 hours just to process them. if they have psychiatric concerns. That's an amazing long time. You imagine staying in an emergency department for 10, 15 hours. By the time it's 15 hours in, you're not your best self anyway. So it just is a long time being in a cooped up space. But the report before you has a number of things in it that I wanted to point out. One is that we served just under 2,000 individuals last year. And that's roughly, well, I'll say it this way, just about 25,000 individual services were rendered to those 2,000 individuals. When we look at our services, we definitely have grown in the services that we provide through the Recovery Stabilization Center, but we've also grown through our Recovery Cafe. We've grown through youth mentoring and school support services that we offer now. We've been doing more now with Department of Children's Services to help families be stronger, to help families be able to come together responsibly and safely. We've been able to do a number of these things because of the funding that we received from Howard County. Currently, we operate with roughly 54 FTEs. That's just a little over 60 employees. Where do we see growth? We see growth in the therapists because our outpatient programming is growing. We definitely see need to grow staff in our peer recovery supports. Some of those services are very grant dependent, and so those are things that we just kind of monitor. But we also see growth and interest in growing supports in school services. What do we do in school services? We complement our community mental health center partners, but mainly what we focus on is helping youth that are at risk stay engaged in school. So when we look at that, we're looking at, we know the kids that start to vape or start to experiment with drugs, and they're vaping younger than they ever have. They stay with it. They don't just give it up. It's not exploratory. So we see kids that are 13 and 15 that start vaping or start using a little bit of pot, and are wondering, do I need to even finish school? And so what we want to do is to make sure kids that are struggling to be able to complete homework assignments, that are having a hard time even regulating their emotions or managing social interactions, that they stay successful in school, because if they don't stay successful in school, they have a lifelong trajectory of hardship that we would like to avoid. And so when we're able to do mentoring and work in collaboration with the mental health center partners, then we can add a complement that really helps kids stay in there longer. Why? Because in middle school, which is largely where we focus right now in Maple Crest Elementary, and then we're doing work in Western and Northwestern through the county health department grant, it's in middle school where kids start to drop out. It's middle school where kids start having to deal with more abstract content, curriculum, and we need them to make sure that they can get through it. When they have somebody walking side by side with them, they're better able to do it, just like adults are when they're working and struggling and managing. How do I maintain my recovery? So those are some of the areas where we're growing. I wanted to be able to share a couple of other things that we're doing. We have been very much attentive to the impact of what we're doing. We do that partly for grants, and partly want to make sure that we're able to show value for what we're doing. And so we use the recovery capital scale that helps us be able to assess how is a person doing with their resources and supports in their recovery. In the beginning, oftentimes when people are very early in the recovery, their recovery capital is pretty low. Towards the end, after 3 or 6 months of supports, the recovery capital is much higher. So we generally will see people increasing their recovery capital basically about 80% if they've been able to sustain services for about 6 months. We see areas where people say, when I've come into the stabilization center, there's a couple of things that are pretty well notable. One is access to medications that maintain cravings or manage cravings, gone up by 70% from time of admission to discharge. When we look at access to treatment partners that can help them in their recovery, 63% improvement, and a 41% improvement in having an environment that's free of alcohol and other drugs. We work intentionally to make sure that when we discharge individuals that we're getting them into sober living, or that we're getting in the care partners that they're helping them change people, places, and things. It's a pretty real deal. If you go back to the same people that you were with before, you'll start using again. The community care impact, I think, is something notable to point out. 65% of our community stakeholders, this is hospital personnel, this is law enforcement personnel, this is other community health center partner personnel, 65% agreed saying that time spent by a hospital emergency personnel finding an appropriate treatment placement facilities has been reduced because of the Recovery Stabilization Center. If you can imagine, we work very closely with Howard and Ascension. If you got somebody that's come in, they didn't die from their overdose, but they know they need care, they get on the phone with their nurses. We have peers that basically visit both emergency departments, because if I can engage somebody there, rather than just sending them out to a community appointment, they'll do better with follow-up. So it's important that we're intentional about working with our emergency departments and others. 86% said the Stabilization Center expands regional continuum of recovery care by adding valuable treatment services. 97% said I'd recommend that the recovery stabilization to a friend or family member. So that's a pretty great endorsement, I think. And when we look at care experience, our care experience ratings are pretty high, and we take a lot of pride in that. But I have no doubt that they would not be as high if we didn't invest in people with lived experience in recovery. So having people that are in recovery work with people getting into recovery makes a huge difference. They're more compassionate, they're more empathic, they're more relatable. People say, I've never been in a place like this where I felt more supported, more understood, and less judged. And so that is why recovery organizations are important, because people in recovery can show, one, hope that recovery is possible, and second, I get you. I know exactly what you're going through. It's possible to get through this. So all of those things are important and helpful. When you think about the general impact, there's a couple of graphs that I wanted to draw your attention to briefly. One is that we've served, since we've started, we've served about 450 people through the Recovery Stabilization Center. Their length of stay is usually around, I would say between about 7 to 15 days on average. But we have a good number of people that complete 28 days in the Stabilization Center. Our average, we have a bed capacity of 12. Our general census now floats between roughly 9.5 to 10 people or so. So it's pretty full most of the time, and that's fine. You can see that the numbers of people served per year have definitely gone up. Back in July of 2021, I think we were serving a little under 250. In January, we were well over 550 people, discrete people being served. So you can see the numbers are going up. But probably the most important numbers for you, and Dr. Seeley and I consulted on this quite a bit before we went public with them, is just taking a look at the overdose rate. So the last page, these are two trends that we basically report to Lilly. And Lilly Endowment helped us fund the restoration of the building and to basically get the program started, in addition to other stakeholders, including Howard County. That graph, I think, is a really important graph. For years, the overdose fatality rate was much higher than the state average. So back in 2017, when we were at kind of the height of the opioid epidemic, when it was really gaining a lot of attention, 53.5 overdoses per 100,000 persons relative to 29. That's what the variance was with the state. We started basically making some pretty good inroads until 2019, where COVID hit. But really what happened is fentanyl hit the streets. And so you can see at the national level, the state level, and the county level, between 2019 and 2020, things went up. But unlike other areas like the state, we basically started coming back down since 2020. And in 2023 is the first year in a lot of years that I'm aware of that we basically are intersecting with the state average. If we didn't do anything in Howard County, we'd still be way above that state average. But it says that the county is investing in a lot of things. One of those things I think is Turning Point. There's a lot of other things that are going on that are helpful, whether it's residential expansion, whether it's more law enforcement support and coordination and working with community corrections. But Turning Point, I can't help but think, if the data wasn't there, I couldn't make the argument. Because the data is there, I'd say, I think having that subacute unit offering 24/7 stabilization, giving people an opportunity to actually start to not use or going into that detox, if you will, that's a game changer. That is saving lives. And that, I think, is what the investment, it makes that investment worth it. There's other data in there. We can see, and I don't know if Dustin's still here, but we were talking, it's like, how you doing with probation caseloads? Because what the data is showing, this is from the state website, you can see the link there below, consistently, we're seeing drug-related arrests be reduced. So I think Judge Elkin probably has something to do with it. I mean, he's reducing the jails. It's just, maybe they're just spooked. I'm not doing anything. I'm gonna get in trouble with him. But in all seriousness, though, we definitely are seeing some decreased trends. And what I think that may suggest is people are getting into recovery and are staying into recovery better. You see it in the fatality data. You see it in the drug arrest data. And so that's coming from the state. That's not our data. The county death stuff, that's coming from Dr. Seeley. That's not coming from Turning Point. We just basically put the things together to be able to report out to Lily. And so I just wanted to share those things with you because I am extraordinarily grateful for our collaborative community. I'm extraordinarily grateful for our team. I'm extraordinarily grateful for a local government, both at the city and county level, that have a vision to say, our people are worth investing in. They're not going away. Let's give them dignity, and let's give them hope and a chance to do better. So with that, let me pause there and see what questions you might have.
I just want to, I don't have a question, I just want to thank you for what you do. It's really important work, and I'm glad that it's getting done.
Yeah, good stats. Appreciate all the graphs and the information. It's good to see you guys up and running for a full year and the numbers going.
Kind of shocking that our population in Howard County is 84,000, and you're so busy, 1,974 clients this year. That's more than 2%. Is that a common percentage? More than 2%?
I'm trying to think more specifically about, say that again.
Well, the total population of Howard County is about 84,000. And Howard County residents served is, well, you have total individuals served,
Gotcha.
1,974.
Yeah, I don't know. That's a good question because the Turning Point definitely is growing. What I would probably, when I think about it, when I was at Community Howard several years ago, we served roughly around 4,000 or so a year at that time.
Mm-hmm.
So that was a few years ago, but the population is definitely growing. The economic expansion is growing. So you're going to see this. And I think that actually, in some ways, makes me kind of wonder a little bit about as your economy grows and is healthier, you start seeing reductions in drug-related activity as well, which is a good investment. But I personally, I just think it'd be good to look at the data more closely and say, okay, you've got lots of behavioral health providers. You've got more behavioral health providers now than you did 10 years ago,
Mm-hmm.
whether it's 4C Community, you've got Life Restored. You've got,
Thankfully, we have more providers.
and not only that, it's 2024, so I go back to 2014. I was thinking, before 2014, you couldn't get insurance for people with substance use issues. So you basically had huge problems with access. You didn't have access to medications. You didn't have access to harm reduction medications. Turning Point itself, 7,200 Narcan kits and harm reduction kits were distributed last year. That's, we had boxes and we had vending machines in collaboration with the state and with Overdose Lifeline. That's a huge contributor to helping people make sure that they're not dying. The fact that they had Narcan more accessible than ever helped save lives because people don't know what they're using on the streets, and they're not just lacing, it's not just heroin that's got fentanyl in it. They're lacing meth, and that's one of our biggest issues right now in our county. But meth is showing up in things like marijuana. So it's like, you don't know where that stuff's coming from. It could be fatal. So it's just interesting thinking about how getting that stuff out there. But I couldn't tell you the exact, whether that's within the norm or if that's, how that rates with other counties. But I can tell you I'm just grateful that we do have more resources in the community and definitely a lot of collaboration.
Mm-hmm. It was a very nice presentation, Dr. Oliver. I want to thank you for coming in and sharing it with us and helping us understand the work that you do in the community that we serve.
Thank you.
Thank you.
It's our pleasure.
Thank you.
Our next bit of new business will be to listen to Public Defender Andrew Vandenbosch, going to give us a fourth quarter report. for the Public Defender's Office for 2023.
Good afternoon.
Good afternoon.
As you, I believe, are aware, the Howard County, I think of the term, the comprehensive plan for the county requires the Public Defender's Office to report annually to the commissioners, to the council, and to the judges. And we've elected to, at least annually, we've elected to do that quarterly in conjunction with our quarterly reimbursement request to the commission, just to keep the council, commission, and judges apprised of the workings and progress of the Public Defender's Office. Our fourth quarter reimbursement request to the commission included $485,422 in total expenditures for the quarter. Of that, $40,769, or roughly 8.3%, were for non-reimbursable expenses, and that's primarily the two misdemeanor attorneys, because the misdemeanors are not reimbursable by the commission. But of the total expenditures, approximately 94% of that is for salaries for the public defenders and staff. 1.2%, or $5,921 in the fourth quarter, was for supplies and equipment, and then the remaining 4.8%, or $25,667, were for other services and charges. But of that 25,000, 21,000 of that was for office expense reimbursement to the public defenders, which is beginning in 2024 now included in supplies and equipment. So, but the vast majority of our expenditures are for the public defenders' salaries. And then we requested reimbursement, anticipate 40% reimbursement, or $177,861 coming back from the commission to the county for the fourth quarter. Our attorney caseloads in the fourth quarter, we didn't have any issues with compliance with the public defenders other than the two CHINS attorneys, which has been rectified by our increase to 80% as opposed to their 70% caseload. And then the appeals attorney was out of compliance, but with the new caseload guidelines that took effect in 2024, we believe with the same number of cases that he will be in compliance this year. So we anticipate that the commission will understand that that's rectified itself by their new caseload standards. That's one of the few positions where in 2024, they're actually expected to take more cases in that calculation of their 70% caseload. We did fill 2 public defender positions due to Rebecca Vent leaving the public defender's office to become the judge of Superior Court 2. And Justin Clauser left the public defender's office to take a position in Tipton as a public defender. And those 2 have been replaced by Brant Perry, who's now taken a position with the public defender's office, and Brooks Ledger, which is an attorney from Logansport, who has taken a position with the public defender's office.
So, excuse me, Judge Perry now is a public defender? Is that
Correct.
right?
He has taken a position with the public defender's office in addition to his private practice, so.
Okay.
Does it make any difference as to which one of those people fill which of those? Like, did former Judge Perry take Rebecca Vent's position, or did he take Justin Clauser's position? And does it make any difference?
It doesn't really make any difference as they're paid the same salary. Initially, he was going to move into Superior Court 4, but he ended up moving into circuit court and taking the position that was vacated by Justin Clauser. And then we had an attorney in Superior Court 4 that moved to the Chins Court where Rebecca Vent was, and then their position in Superior Court 4 was filled by Brooks Ledger, who came over from Logansport. And he previously was a full-time public defender in Tippecanoe County, but felt that he would prefer to come here and practice in Howard County. Indicated he felt it was a little closer and the salaries were very commensurate, and so he has joined us and taken the position. And then we also filled the position for second investigator, Jake Willie, who was employed in Superior Court 4 as the bailiff, I believe was his title, is now working as the second investigator with the Public Defender's Office.
Could you take a question on the financial information?
Sure.
The non-reimbursable expenditures, I thought earlier in the legislative session, there was some proposed legislation to increase the amount of reimbursement to counties that might be associated with the defense of misdemeanor. But I don't know, frankly, I haven't followed it that closely to know whether that's died or whether that is still pending or.
Well,
Do
my
you know what's happened
understanding,
with that?
it's still going through, but my understanding is that there's going to be a pilot program.
Right.
And I think
I
there
heard
are,
that.
can't remember if it's 5 or 9 counties
Maybe 7
that are
counties.
going to get reimbursement for their misdemeanor cases with the intent that by 2029, they will take the rest of the counties on board. I
And
did
we're
get,
not one of the pilot counties.
No.
I remember, you're refreshing my memory on that.
but I did get an email today indicating there may be some changes to that, talking about potentially reimbursing for misdemeanors at 25%. But I don't know if that requires strict compliance with the county, with the caseloads. Because if it does, I don't know that that would benefit us for the additional public defender or 2 that we would have to hire to be in compliance to get a 25% reimbursement. But that's still working its way through the legislative process, so we'll
Keep
have
your
to
eye on the bouncing
keep an
ball,
eye
right?
on it and see how that comes out.
Okay, thank you.
Any other questions? I would like to take this opportunity to invite all of you to come to the court. And we have several high-profile jury trials that are going to be going on this spring, including at least 2 or 3 murder cases. So if you have the time to stop in one of the courts and happen to know whether, the trials are ongoing, I would invite you to stop in, take a seat, watch the trial in progress, and see some of the fine work that the public defenders are doing on behalf of the county for their client.
Do we get any notification of when those are?
I'll be glad to
That would be great.
send something to the council and let them know when those are going to start.
That would be great, because it's very interesting just to sit in a courtroom and watch the process. I mean, it's not easy, and it's difficult, so thank you for bringing that up.
You're welcome.
Well, I can't think of a stronger personality that we should all emulate than Atticus Finch, public defender. So, thank you for your presentation. It's very helpful in helping us understand.
Where in here does it show that you're out of compliance in all this packet? You said your chins were out of compliance, but is it back in here where these
Yes.
are highlighted?
And the ones that are misdemeanors, but it's going to be difficult for you to. Our two Chin's attorneys were Rebecca's, and they're not, I don't think they're listed, the individuals.
Yeah, they don't have a name, but that's all right. So
But they're-
those boxes are
But
highlighted.
the ones that are around 200% or more, those are the misdemeanors. The ones here on this page that were 113%, I can't see that without my glasses, but it says 111. Those were the Chin's attorneys.
Okay,
And then I think on the last page was the appeals.
that's all I was getting at. So if those boxes on the right are highlighted, those are the ones,
Right.
they're out
They're
of,
compliance.
out of compliance for that quarter.
Correct.
Okay, thank you.
Mr. Vanden Bosch, thank you very much for coming and speaking to us today.
Thank you. Thank you.
Thanks for
giving
putting
me
that
the-
together, Scott.
Yeah, I was gonna say.
Thank you. Well, by golly, our next order of business will be we're still in new business, and we have to deal with the 2023, 2024 encumbrances report.
So this is in your packet, but this report shows the total amount of appropriations brought forward to pay our 2023 invoices that were paid in 2024. And the grand total is $686,076.32.
That's good. That's good. It used to be that there would be over $1 million a lot of the time.
Say that again, Martha?
It used to be that this encumbrance would be over $1 million,
Okay.
so, and it always takes away from the balance that you see. You know that you still got this coming from the previous year, so, it's good.
Is that it?
Yeah.
Okay.
So that's good? What,
It
that
is good.
lower?
The general opinion is it's good.
Yes,
That's it. It's good news, and it's lower than what it used to be in the past.
right, because
So
it
we're
does,
just getting better with time.
Like a fine wine.
Yes,
like a fine
Yes,
wine,
I
yes.
see a consensus on that.
Yeah.
Thank you for that information. Let's see, our next order of business is to deal with the resolution number 2024-HCCR-03, authorizing an emergency transfer of funds. Can you elaborate on that?
I have that resolution. This is a resolution that follows Indiana law, allowing the council to, by resolution, authorize a temporary loan from the rainy day fund for emergency cash flow purposes. The resolution is in order, and I'll pass that down.
Okay. And this is basically, is this not just a bookkeeping correction? And our normal funds are not available for this, so this is we're borrowing money. We're borrowing money till our next meeting, where we pay it right back, and the books are straight, and it's just a few cents here and there is pretty much what it is. Yeah. Well,
It's a good thing too, because I didn't know about that, and Jamie, when she came in, she brought that with her from the schools, and that actually keeps the books cleaner, the bookkeeping cleaner, and it makes a big difference when we're being audited as well.
yeah, okay. Is there any questions or comments about the resolution?
I remember when I was on the Western School Board, J.O. Smith told us, when you take money from the rainy day fund, one of the first questions you ask is, how hard does it have to rain before you can take money from the rainy day fund? But that was a long time ago.
Well,
Well, that's gonna get put right back, so.
if there are no questions or comments, I will entertain a resolution or entertain a motion to approve the resolution number 2024-HCCR-03, authorizing emergency transfer of funds.
I move we approve.
Second.
Motion's been properly made and seconded by Councilman Faulkner and Councilman Alexander. All those in favor say aye.
Aye.
Those opposed, same sign. Motion passes. Thank you very much. Were there any announcements? Any Any comments anybody wants to make? Council?
There's one of these events from the Association of Indiana Counties. It's, I believe it's on March 21st up in Plymouth. I learned that we are actually in the Northwest District of Indiana, which,
I was wondering about that.
well, I wondered about it too. It's not necessarily that logical to me. We're kind of right on the boundary of 4 districts. So I guess if you participate in anyone, but officially with that group, Association of Indiana Counties, we're in the Northwest District.
But you can go to any of the meetings. I mean, the one that's closest, usually Daryl and I have gone to the ones that were closer if it was more convenient, so. And I think Daryl went to one this year already, haven't you?
Yeah, I've been to a district meeting, and then Frank and I, February 6th and 7th, it seems like a lifetime ago.
Right.
We're down at the AIC Ledge meeting in Indianapolis and had a good time, talked to other council people and auditors and treasurers, so it was a good conference.
Okay.
Did you see the sheet, and Gabrielle, did you put this in here for us to see about the lit fund so that we know that right, because, yeah, okay, well, I don't know, we don't know why, you got the email that we were gonna be $800,000 short in the jail juvenile fund, and it was a mistake on the part of the state. And they, when we asked to take it to the legislature, they re-looked at it and found out it was a mistake on their part. So we had a levy that was higher, and they made the levy lower and actually adjusted our funds so that we would not get that 800,000 that we were planning on, and then all of a sudden they fixed it. So it was a good thing that we studied it a little bit, okay? So
Yeah.
that's a lot of money not to have.
Well, if there's no more comments, I will, please come up. Please state your name.
Hey, my name is Anthony Walker.
Hi,
So
Anthony.
I just have 2 questions. One, for the public, why is there not a public comment section on here, but there are for the, like the commissioners meeting? By the way,
Well, I'm sure we can add one.
yeah. Thank you. And then the second thing is like for the consultants, I'm confused on why, for the financial consultant, I know it's kind of late, you guys are at 5 o'clock, but why are you guys trying to hire a consultant for?
Well, it's not that we have to have one. According to all metrics, Howard County is well-ran according to best practices, according to the State Board of Accounts. And this is a suggestion from some of our council members as they attended a state meeting of council members. And that's some of the advice that the speakers at the state conference was saying to the members of the audience, that you might want to think about getting a financial advisor, because the work of the council is little known to the public in general. It's very complex with a myriad number of revenue streams and revenue expenditures. And you got different sources for different departments, different funds. It's like a spaghetti bowl in a lot of ways. And a financial advisor, as we look on this board right here, Anthony, I'm a plumber. We have a farmer, have a school teacher, we have a accountant, auditor, we have a very talented individual down here in the corner, and what do I call you? Administrator? What are you?
Yeah, I'm a financial administrator.
Talented next generation coming up.
Love it.
Frank is
I'm a volunteer grass mower out at the Grissom Air Museum.
Yeah, I get, okay. So have you guys reached out to other counties to figure out, like Tippecanoe County, for an example, of what they've done? Have they too hired a financial consultant?
Yes, there are other counties in the state that have done this. We're not the only one.
Right.
Okay.
I think our
So-
basic reason is to look at our projects that we have now and look at the projects coming down the line, okay, and making sure that we are not surprised by anything. The auditor's office does a fantastic job keeping the numbers and knowing the tax amounts that are coming in, the revenues.
Yes, she does, yeah.
And so what we really want to do is be sure that we're prepared for, look down the road and make sure we're prepared for whatever might be coming and, you
So
know.
there's no more surprises?
No,
Because I
we-
think I've been at a couple of these meetings and I'm hearing the word surprises a lot. So will this
Yeah.
consultant be able to help with the surprises, right?
Well, and I think probably we'll just meet them maybe one time a year or, you know,
Okay.
it's not something that we would use all the time.
Okay.
But somebody who would help us, be sure not to forget anything and
All right.
plan accordingly.
That's all I have.
Yeah,
I
Anthony?
just wanted to know.
I would encourage, I don't want you to think the wrong, or have the wrong impression of the council here with the word surprise.
Yeah.
This is a very well-run group.
I know you said that 3 times already.
Well,
I know.
it's worth shouting, and
Yeah.
it's worth shouting out and let people know. We are disciplined, we are organized, we are selfless in our service, and we are transparent. And I'm singing that to the audience tonight, and that's all I gotta say.
John, you're a good person. You're a great person. Glad you saw me.
No, I'm
So I
happy.
appreciate all you guys. Thank you so much for the sake of time. Thank you.
Come and ask
Thank you.
questions anytime. We appreciate us,
Oh,
somebody coming to ask questions.
I'm a question guy, yeah, I'm a question.
Well, thank you. We
You guys have a
appreciate
good
that.
Well, if that's all, I will entertain a motion for adjournment.
So moved.
Second.
Motion's been properly made and seconded by Madam Councilwoman Lake and Councilman Faulkner. All those in favor say aye.
Aye.
Opposed, same sign. Motion passes. This meeting is now adjourned.